The experience since I started has been phenomenal. Phenomenal. I like to take baby steps and not do too many things at once until I get a grasp. I just always remember my dad saying, jack of all trades, master of none. So, I can tell you as of today, we have about 20 patients pregnant. And fertility, I never really, I don't know, had the desire to specialize in fertility. But through this process with adding the footsoaks, I absolutely love the fertility patients. And what I have seen when you combine the foot soak with the acupuncture, it's phenomenal. And I'm just started to do video testimonies, and some other testimonies are starting to come in. And I just had one of a couple, and I remember them months ago, who came in, and he was a police officer, and he said, okay, I'm here, and whatever you need for me to help you get my wife pregnant, I will do it. And I'm like, all right, nothing like any pressure. And she just recently gave me a testimonial, and she called it her little foot soak acupuncture baby. And they're having a beautiful, healthy baby girl shortly. And the neuropathy patients, I think other practitioners has spoke to the success of treating neuropathy with the combination of the foot soak and just adding the foot soaks. So chronic pain, fertility, and neuropathy is what I have had the great success with. What I find initially before their first session, I explained to them, you could be solo and you could be in a room with 3 other people. Most of the time I kind of get a look like, I kind of really prefer to be by myself. And that's really not an option because, I have my room set up that it could be 4 people at any time. And the sense of community, I've seen friendships develop. I've seen patients, witness other patients being present when the patient announces that they're pregnant. So the other patients, they kind of feel like they're a part of something beautiful and wonderful. And they were there the whole time as these fertility patients were on their journey. And so it boils down to a sense of community. And I have seen patients, the friendships just blossom, and they meet outside of the clinic. And I see that a lot. I hear patients. I'm always listening, and out in the waiting room, I hear them. Oh, what day are you coming? What time? Okay, I'll make sure I'm there. I'll make sure we'll schedule at that time. And so the real sense again of community.
That's really wonderful. That's what we experienced at our clinic as well. And, that's really a part of the Chinese landscape is, meeting at these kind of foot soak places or going there with friends. And, people may go every day for 3 months together for arthritis or, some severe knee pain. And as the tissue is remodeling during that process, people become friends. And then what's really nice is that maybe as a result of the treatment, people are feeling a little better, and then they start to do group dancing together, or they start to do Tai Chi together. And then they're out of your clinic, but, they're getting healthier by the day, and they continue to cultivate these friendships and cultivate community, and then maybe are back when they're bringing new friends.
Yeah, at this point, I don't really do a lot of referrals. I can tell you since I added the foot soak, it's just been phenomenal. The patients that, maybe not everybody wants acupuncture, maybe, but I can tell you I don't know of anyone who doesn't want foot soaks, who doesn't like the ideal, or So it's much easier for people to come in when family members will attend a session with a patient, And then I'm often, well, is there any way you can fit me in? You can do mine in a waiting room. And something I just started, and I don't know why I never did it all along, but I've heard you talk about offering the tea at the time of when they first come in. I do it during, but never like during the intake. And I just started that this week during the new patient intake, offering them tea. It is phenomenal, phenomenal. The patient is so relaxed. And initially I found they just, they're coming in for their acupuncture evaluation, but before it's all said and done, they have to get to the room. They have to walk past the foot soak room, and then they see everybody in there talking and laughing. And they're like, well, can I join the next group? And then they're at my clinic for 2 hours because they did A, B, C, and D. And then they went home with the whole bag of tools.
Are you giving them Shio tea?
Yes.
Okay, great. So you'll get the chi and blood moving right away. A big part of getting good intel from a patient is that patient rapport. And the more nervous they are, maybe they want to tell you everything, but it's hard to remember my short-term memory starts to go if I am in a higher stress situation. I think that's true of most people. So getting everybody very relaxed before we start asking questions, particularly questions that may be very personal or intimate, I find that's just such it's a non-alcoholic social lubricant in that way.
Absolutely.
Awesome. Well, I really love to see the progressions that you have with your foot soak room and all of the wonderful testimonials and incredible work you're doing. Outside of some, really nice clinics in Tibet and China, I don't know that there are many people who have dedicated foot soak rooms in the U.S., although, I think many are following your example now.
That is my goal. I do want a high-end foot soak center. So I wanted to test it first. I tested it. I love it. And I do like it. That is my vision to I think it's awesome. My patients think it's awesome, and my credibility at this point is they know I teach them right away. I'm big on education. This is not spa, and this is not the goofy stuff you stick your feet in and the water turns black.
Right.
I know in my area, patients they've heard of the detox, foot soaks that you put your feet in and you're detoxing and the water turns black and all this and that. And so they have been able to, communicate that effectively to the community. And my fertility calls have increased dramatically. I have patients now coming an hour and a half to my clinic because of having the foot soak room.
These foot soaks are used quite a bit in East Asia for gynecology, and we're going to get into specifically why they're working for fertility cases. So for gynecology, they have studies in China on menstrual cramps caused by, it's called cold and blood stasis, and we'll get into a little bit about what these yin excesses mean. But in these cases where there's cold and blood stasis, 7 days before the period, foot soaks are administered, and it alleviates the cramps. For pelvic inflammatory disease, with or without antibiotics, it's been shown to alleviate symptoms when used daily 20 days in a row. For fertility, specifically with luteinized unruptured follicle syndrome, it aids ovulation when used daily for 3 months. Now, this daily use for 3 months is what we tend to see with more serious diseases. Generally speaking, foot soaks that are made out of aye, mugwort, will generally warm the uterus. However, there are additional herbs in our Tibetan foot soak mix which have incredible effects on the system as a whole. One in particular is Tibetan Shichangpu, Zhangchangpu, which is a form of Acorus tatarinoai. That's my best Latin. This has antidepressant effects within its essential oil, acerone, or acerone, I'm guessing that's how you pronounce it in Italian, Tibetan Shichangpu has a two-way regulatory effect of both exciting and suppressing the central nervous system. This contributes to the mechanism that it has of protecting neurons and improving permeability of the blood-to-brain barrier. The volatile oil itself has significant protective effects on the cardiovascular system. Other herbs in this formula contain incredible levels of volatile oils. Hongjingtian alone contains 63 volatile oils, such as geraniol, geranyl acetate, and squalene. These herbs are also incredibly rich in alkaloids, and this is really what's going to transmit transdermally through the skin. Some of the herbs which are used in foot soak blends are very heavy kidney tonics, like dihuang, but they don't really soak through the skin all that well. They aren't rich in the kind of terpenes and volatile oils which will actually get in, which means that they tend to be a waste of money. So it's important to look at what is actually going to be getting into the bloodstream transdermally and exclusively working with those herbs at high quality, because the higher quality herbs are richer in those volatile oils and terpenes. You don't want to just be soaking your feet in a bunch of twigs that aren't bioactive. Another key aspect of these Tibetan foot soaks is that they're rich in sulfur, and this is an important sulfur donor for hydrogen sulfide. Hydrogen sulfide is produced within the uterus and endothelial lining. The uterine artery also biosynthesizes hydrogen sulfide. This is an important dilator to bring healthy blood flow around the reproductive organs. Too little or too much is associated with fibroids, dysregulated menstruation, and infertility. So when you get the hydrogen sulfide to a sweet spot, you start to get spikes in fertility. Changes in the concentration of volatile sulfur compounds in the mouth can be detected during the menstrual cycle. The amount of this gas, or literally qi in Chinese, can be detected on the breath and changes during the menstrual cycle. And this gives us additional insight into why we kiss as part of the human mating rituals and why scent or smelling is part of Chinese medicine diagnostics. This can be detected just as methane is detected on the breath of people who are in states of obesity. The levels of sulfur change throughout the menstrual cycle. So we know that there can be too much of this gas, there can be too little. Generally speaking, within gynecology in China compared to how it's practiced in the US, in China people focus a lot on the yin excess, that is, that which is blocking the healthy function. Here in the US, people often mistakenly will think that there's deficiency because they see signs of people being run down without looking deeper to see what's blocked. So this Tibetan foot soak formula really addresses the causes of inflammation, such as blood stasis, wind, damp, cold, and heat. These types of pathogenic factors, as they're called, are generally associated with inflammatory conditions that are associated with the immune system. What is the connection between the immune system and fertility? Well, actually, it turns out there's quite a really big influence there that gets overlooked. So these herbs work via inflammatory cytokines and immune factors. So how can addressing this inflammation, like we'll do for treating arthritis and back pain, also influence fertility? Two cytokine-induced genic products, important in inflammation and infection, also play essential roles in female fertility. One of these is a product of tumor necrosis factor and TNF-stimulated gene 6, which is TNF-alpha-induced protein 6. Originally cloned from diploid human fibroblast stimulated with TNF. The second is Penetrix 3, which is also called TSG14, which was originally isolated from TNF-stimulated human fibroblasts and from interleukin-1 stimulated vascular endothelial cells. TSG, which specifically binds to hyaluron and to inter-alpha inhibitor, shows potent anti-inflammatory activity in acute and chronic inflammation in several models of autoimmune arthritis. This has been shown to play an important role in resistance to fungal infection. Both TSG6 and PTX3 are synthesized in the ovary prior to ovulation, where they become components of an expanding viscoelastic matrix that surrounds the oocyte before it's released from the follicle. Female mice with a targeted disruption of either the TSG6 or PTX3 gene show severe defects in fertility. So these inflammatory cytokines are absolutely vital for having healthy fertility. There's an important interplay between female health, gynecology, and the immune system that's incredibly overlooked. And this is why traditionally, whether you look at societies like Zapotecas in Mexico or areas of East Asia, there's always this idea that if you're pregnant or right after you give birth, you're not to be exposed to cold air or exert yourself, or in other words, to protect the immune system at all costs from having these spikes in inflammation, because these inflammatory cytokines can and do influence prostaglandins and blood circulation, and specifically gynecological health. So this is why people are using the Tibetan foot soaks just on autopilot, and people are getting pregnant right, left, and center even when they're in their 40s. By moving blood, moving out the wind, damp, cold, and getting rid of anything that's actually in the way. So there's certain types of bacteria which can influence fertility. There's a lot of antibacterial volatile oil action within these foot soaks. So even as people are getting the foot soaks, as it's soaking into the skin, into the bloodstream, that's traveling up the insides of the legs and directly affecting the reproductive organs to kill bacteria that doesn't need to be there and provide healthy blood circulation so that menstrual cycles are right on time, that fertility gets turned back as far as the clock that's ticking. So many women are afraid of that ticking clock because it reduces inflammation, and inflammation accelerates aging. It can in fact turn back that clock that seems to be ticking, and it ticks louder as women get to their late 30s and early 40s. There's a lot of fear surrounding the loss of fertility. And a lot of this loss of fertility is caused by what are called these yin excesses of blood stasis, wind, damp, cold, which are in fact the interplay of the immune system and the female reproductive system, which is an area that's all but ignored in conventional medicine and yet scientifically supported. This is an area where Chinese medicine, Tibetan medicine, in particular, these Tibetan foot soaks really shine because they come in at the highest quality, which means they're going to have the greatest richness of these essential oils, volatile oils, and at a very high purity level. So that's something that we can rely on for clinical certainty when things may look murky and be otherwise hard to understand.
I used to carry every herbal formula I could get my hands on. You can just imagine how this clogged up shelf space and mental space, plus it gave me a lot to dust every week. We looked at our most effective products, our automatic top sellers, and found that they coincided with the most popular and effective herbal products in East Asia. We decided to focus on the winners and then make them even better. Our research team in Chengdu upgraded these formulas using the highest quality herbs on the planet and rigorously testing them at pharmaceutical standard for quality and safety. You'll want to get your hands on this, and you'll get your supplies at botanicalbiohacking.com. Thanks for listening to the Botanical Biohacking Podcast. I'm your host, Andrew Miles.